how do you determine what dosage to give to any patient who requires this chemotherapy?
Everyone's dose is also different. We compute something called body surface area using your weight and height. We have formulas and applications that we use, and then we multiply that factor by a certain dose that has been predetermined based on clinical studies that have been done mainly in the West, and that's how we decide which dose is right for you. So you'll find that somebody who's slightly heavier, slightly taller, will have a bigger dose compared to somebody who's more small in body size.
During mixing, what we do, we have something that sucks the most of the fumes because we are dealing with most cytotoxic drugs. The purpose of the sucking is to minimize contact between whoever is mixing and the drugs because they can absorb even through the skin. What I'll do first, I'll put on my machine. After that, I already packed my drugs around. Whatever I'm mixing is called the oxaliplatin, and as you can see, it is put into an amber colored bottle, which means you'll be protected from light. Now when it's in this bottle, it means it's already protected, so the light will not affect it so much. Oxaliplatin is mixed in 5% or dextrose. Whenever you put it in a normal saline, it forms some kind of, there is a kind of reactions. So what you do, you put it in 5% dextrose. Now this is my normal saline, my 5% dextrose, and these are my drugs. I want to mix 215 milligrams of oxaliplatin. Whatever I have packed in this one bottle is 100 milligrams of oxaliplatin. So I'll have to calculate the 15 that is remaining from 300. Yeah. You'll find that it is around these two, which is 50 ml. Times 2, that is 100 ml plus 7.5 milliliters. We normally use syringes and needles. The purpose of cotton here is for cautionary purposes. In case it spills out into my skin, I'll have to rub it very fast. Yeah. And I have water around also. Reason. So I'll withdraw. This bottle is 50 milliliters. Okay. Since you expect a lot of pressure, I normally use cotton wool to prevent the spillage.
How much do these drugs cost? Like for this one bottle of oxaliplatin, what's the cost?
They are very expensive. For oxaliplatin, I'm not sure about the price, but it's around 35,000. This bottle of 50 ml, yeah. But we have more expensive one like trastuzumab is about 140,000
So,
per
so
vial.
this will be 35 by 3.
By 3.
Which is 105,000.
Yeah, but it depends with the supplier.
Sometimes you might visit a hospital, you are told a certain drug is not available, go across the counter and get one, and maybe you're financially unstable.
Of course, there are side effects, you vomit, but there's medicine to curb that. You don't feel like, the body is being, chemotherapy kills cells, so you feel weak, fatigue, you feel like giving up at times, but it's not a bad experience actually.
Immediately after application 1 week, I feel like vomiting, although not vomiting, but my eating is not the normal one. There is this other one like itching. There are some times when sijui inaitwa nini kwa Kiingereza kuvaganzi, mwili unasikia umeganda kila pahali.
And what are the common side effects of chemotherapy that patients undergoing this treatment process should expect?
Most of the common side effects of chemotherapy, especially the old drugs, will include hair loss. It's quite a common side effect. We can get fatigue, we have nausea and vomiting, we have increased chance of getting infections and getting blood clots. However, most of these side effects, we have overtaken them because we have new drugs that help to prevent or to mitigate many of these side effects. So you'll find that the chemotherapy that we're giving to patients now is much better tolerated, and patients are having less and less side effects, especially the nausea and vomiting. Many patients fear that they'll have a whole week of vomiting, and nowadays you find people go through their 6 months of treatment with absolutely no vomiting or nausea at all.
Like yesterday, because I knew that I'm coming today, the eating habit was not normal, just because of whatever I normally feel after getting this drug. But other days I'm okay. And so there is that one action says.
Of all the side effects that you'd had of chemotherapy, which one were you most afraid of?
Pain, vomiting. Yeah, because before treatment, before surgery, I was really vomiting, and it was really bad. I hated it, so I was afraid of vomiting, and it's there still, but you manage it.
Before then I knew nothing. I knew nothing about the side effects.
Since these side effects are expected when giving chemotherapy or when a patient is undergoing this chemotherapy process, what ways are there to help lessen the effects of these drugs or to completely prevent them from happening?
One of the most important things that we do is we educate the patients about these side effects so that they know that such a side effect is expected and it will be easier for them to manage it. I'll give you an example of something we call peripheral neuropathy, or numbness and tingling of the hands and feet. It's quite common with many of the newer chemotherapies that we use now, and we tell patients if they begin to feel their fingers are getting numb, they can't take things out of the fridge, then we tell them to let us know early on. We can change the dose of the drug, we can give them other drugs to help with those symptoms, we can tell them to wear gloves and keep themselves warm. So if a patient expects a certain side effect, managing that becomes even easier because we all are communicating together and we know how to attack certain side effects. When symptoms become bad is when patients are not communicating with their doctors, so they struggle at home and they imagine that they must have these side effects, which is not the case. If there's that constant communication with your caregiver, then we catch some of these side effects early and we prevent them, or even prevent them from happening in the future, because people's bodies are different. Not everybody gets the same side effects. So once we learn you as the individual, then we can plan for you in your subsequent cycles.
My mother makes me juices, vegetable juices, fruit juices, and they really help a lot. Yeah, they're very good. What else do you do? Well, at times you do exercises, of course. Yeah.
Before you started chemotherapy, What did you have in mind, or what did you think chemotherapy is all about?
I asked people, and then somebody told me unadungwa dawa direct kwa veins. So I was like, is it painful? And they're like, yeah, it's so painful. Usually some people scream, you know. So when I went the first time, I told the doctor I'm not psychologically ready. The second time also I was not ready. Then when I started, I felt like it's just normal. You know, you just go, they put an IV, put you the medicine, then you just go home.
By that time, I could not differentiate between radiotherapy and chemotherapy, so I thought it is where I'm going to be put under some rays of light, maybe to subside whatever the growth which is in my stomach. So that is what I thought. I never thought that it is some chemicals.
Having talked to some of the patients, there are some expectations or some things they knew about chemotherapy that, well, made them more anxious when coming for treatment. What are some of these myths and misconceptions that people have about chemotherapy that you get to hear about during your day-to-day interactions with the patients?
There are a lot of misconceptions about chemotherapy. I've met patients who will tell me, Doc, I feared to come for chemotherapy because I was told it will burn my hand, you know, and I'll feel so much pain and I'll not be able to sleep. And what I tell patients is, if your chemotherapy is given well, it is actually a pain-free procedure. It will not be any different from having antibiotics running through your drip. We have many new drugs nowadays that do not have the traditional side effects that we had in the past. And if you discuss your side effects with your doctor before the chemotherapy process, during taking of consent and understanding what you're going through, then many patients actually sail through the process without major significant setbacks. And a lot of the myths surrounding, you know, it's almost like people become possessed with like a demon and they want to fall down and they imagine like it's actually a poison. Well, it might be a poison, but if it is done well, then patients do not experience any of the burning and the itching sensations that they may think that comes with giving chemotherapy.
What is the cost of chemotherapy drugs, or what is the cost of this chemo treatment?
The cost of chemotherapy, it can be quite varied, but look at it in three aspects. You have the infusion process has its own separate charge. You have the consumables and the things that we use to administer that process is maybe charged differently. What makes the biggest difference is in actual cost of the drug. You'll find some drugs are costing a few hundred shillings and some drugs are costing a few $1,000s. So that can really vary the price of certain drugs, and different drugs which work in different ways will be costed differently. So there's no fixed price for chemotherapy. What might be fixed is the institutional costs of infusion, you know, the doctor's charges, and maybe the infusion process. But what makes it different is actually the cost of the individual drug.
There are some investigations, sometimes they are not available here in the hospital. You are told to go and look for them somewhere else. Financially, it is strenuous. Secondly, you don't live around the hospital, so you are coming away from somewhere. You are employed, so there is this push and pull between you and your employer, because you want information, you want this.
After you had done the first round of chemotherapy and you were told that it's gone, how did you feel at that time?
I felt so good. Of course, I felt like a victor.
And when the news came that it has recurred?
I was so stressed. I really cried. My mom was there for me, my boyfriend, my brothers, my dad, they're all there for me. But mom was always there, encouraging me, telling me, "Don't worry. We are going to make it through." So I was kind of depressed, but I just had to accept again. and start medication.
I've gotten a lot of support which one would wish. From friends, relatives, my fellow workmates. I can say I have gotten support, enough support.
Chemo buddies, or the patients, the caregivers who accompany the patients to the chemotherapy process, be it the relatives, brothers, and friends, those are also very important in terms of supporting these patients throughout the process.
I'm looking forward to being told that it's gone again and it won't recur, and I'll go back to my normal life, go look for a job. I graduated, and during graduation is when I was, that period, that's when I was in surgery, So I've not experienced the life of working really like my other classmates. So I'd love to experience how life is like. I want to start my own life, start a family.
My expectation is to get healed and continue with my normal life.
Do we have capacity as a country to manage cancer?
Capacity will always fall short in terms of the resources that we have, but whatever resources are in place now, they can deal with part of the problem. Obviously, it's not enough to deal with the entire problem. There's a lot that needs to go into cancer management, and not only at the tail end of chemotherapy and radiotherapy, but starting from the beginning in terms of prevention, screening, early detection, catching them early, offering the correct treatment, ensuring even survivorship. If you treat somebody and then they get diabetes and heart failure and die 2 years later, then you wonder what you may have been doing. So there's that document called the National Cancer Control Strategy, which has all these aspects in place. It's all about implementation. And I think once that is done, then we'll be in a good place.
I just want to tell people that cancer is not a killer disease. Sometimes it's in the mentality. It just depends on how you take it. If at all you want to get well, you have to accept it and believe that you're going to get well. Because they usually say, if you believe you're going to die, it's true, you're going to die. Yeah. So if you believe you're going to be well, you will be well.
According to the way I have observed people down here in the village, they have seen it as if this person is the next one to die. So, sometimes when you are talking with me, kuna yale macho unaweza kuniangalia nayo inionyeshe kweli wewe unaona kweli ninakufa. You are very much sympathetic, more than I myself will seek. That is what I have realized. But I can say to anybody, if it is diagnosed that you have cancer, it is not the end of life. It is not the end of life. Otherwise, people have lived with it, and many are doing it.
That is where we conclude this episode of Chemotherapy for Cancer Treatment and Management. And you've heard of the different options that are there when it comes to chemotherapy and what chemotherapy is used for in managing cancer. I'll leave you with a sneak preview of what is coming up in our next episode and our final series on this episode of Diagnosis and Management of Cancer. And next week, we will look at surgery for cancer care. I've been your host, Dr. Mercy Korir.